Allergy is when your immune system identifies something as harmful when it's not actually harmful. And because it identifies this as being harmful, it forms antibodies and you have a reaction to it. Why the body regards something as harmful when it's not is not clear, but we certainly see a very, very common, maybe 1 in 5 of the population have the body doing that, where it identifies something as harmful that is not actually harmful. They can definitely develop later in life, although the majority of people, the asthmatics, the people who are allergic to certain foods, they often in childhood already show problems with nuts or problems with hay fever and that. So I would say it mainly develops, at a young age, but there are definitely some people who have a late bloomers, like you'll see people who've never been asthmatic in the age of 40, 45 develop asthma. A lot of times, obviously, the symptoms are very characteristic. People come in and they've got the runny nose, they've got the congestion, they've got the sneezing. You look in the nose, you see swelling of what we call the turbinates inside the nose. You see the watery eyes, the red eyes. And then the way you confirm it actually is indirectly through a blood test, because the blood test shows a certain white cell elevated called eosinophil, and that high number indicates there may be some allergies. But the main way is to actually do either a blood test of antibodies or a skin test. The blood test antibodies are a little less sensitive because antibodies can wane over time, but it's comprehensive in that you can test for a lot of things. The skin test is usually a prepared kit of 60 of the most common allergens. You put them on the skin, kind of like a blunt pressure on the skin, 60 allergens, and then in 15 minutes the medical staff comes to read it, and then depending on the size of the reaction, they can tell how strongly positive you are to the allergy. Is it a mild, moderate, or severe? So the skin test is really, I think, more the diagnosis of choice, the diagnostic method of choice. They're certainly not cured with the treatment we do, which is the saline and the Flonase and the Zyrtec or Claritin. Those are more symptomatic relief. It's not really curing them. The question is by shots or drops under the tongue. In other words, to desensitize someone, to say, okay, these are your things you're allergic to. If you will follow this thing of coming in once a week to have your shot, or there's a new method now of putting the allergy treatment under the tongue, which is wonderful because they don't have to come to the doctor and sit around for a while and pay a copay. They can actually be in charge of their own thing by putting drops under their tongue. It's well absorbed into the circulation that way. It's as good, we think, as the shots. And that's the one way that you can try and cure somebody, by giving them small amounts of what they're allergic to, and then over time they don't develop a tolerance to it.